Assalamu alaikum and good morning. We are from Group A. We are Nashrul, Safika and Chaying under supervision Professor Dr. Salina Hussain. We are given topics chronic rhinosinusitis. Rhinosinusitis is inflammation of the nasal cavity and paranasal sinuses. It characterized by 2 or more nasal symptoms must have either nose block or discharge with or without facial pain, anosmia, and evidence of disease in osteometal complex. ORCT scan evidence of sinus involvement. Thus chronic sinusitis is a chronic inflammatory disease of nasal and paranasal sinus mucosa where symptomatology has continued beyond 12 weeks. Our contents in this topics are epidemiology, classification, causes, risk factor, symptoms, investigation, clinical examination, treatment, referral and reference. The prevalence rate of chronic rhinosinusitis in Europe, United States of America and Brazil is between 5-15%. In the Asian region the prevalence rate reported in Korea, China and Singapore are 7%, 8% and 2.7% respectively. Chronic rhinosinusitis can be further divided into chronic rhinosinusitis with nasal polyp and chronic rhinosinusitis without nasal polyp. Chronic rhinosinusitis with nasal polyp associated with hyposmia, anosmia and predominance of eosinophiles, high levels of histamine and Th2 cytokines. While chronic rhinosinusitis without nasal polyp associated with facial pain, pressure and or fullness. The organism involved are Streptococcus pneumonia, Haemophilus influenzae and Staphylococcus aureus. It can lead to glandular hyperplasia and submucosal fibrosis. The causes of rhinosinusitis are 1. Nasal polyps 2. Deviated nasal septum 3. Other medical conditions 4. Respiratory tract infections 5. Allergic such as hay fever. There is a higher risk of chronic rhinosinusitis in patients with current and past exposure to secondhand smoke compared with no exposure. Other significant risk or associated factors of CRS are positive family history of chronic rhinosinusitis, asthma, especially with the presence of CRS with nasal polyp, allergic and non-allergic rhinitis, gastroesophageal reflux disease, sleep apnea, and tonsillitis. Smoking, family history of CRS, asthma and GERD are important risk factors for rhinosinusitis. Common signs and symptoms of chronic rhinosinusitis: nasal inflammation, thick, discolored discharge from the nose, drainage down the back of the throat, blocked or stuffy nose causing difficulty through your nose, pain, tenderness and swelling around your eyes, checks, nose or forehead, reduced sense of smell. Other signs and symptoms can include ear pain, headache, aching in the upper jaw and teeth, cough or throat clearing, sore throat, fatigue, bad breath. For physical examination, in diagnosing CRS, anterior endoscopy has limited value as opposed to nasal endoscopy, which provides better visualization of nasal pathologies. Plain radiography has no role in diagnosing rhinosinusitis. CT scan is the gold standard for radiographic evaluation of the paranasal sinuses. The indications are failed medical therapy, plan for surgery. Rhinosinusitis with complications such as pendient orbital ear infection, biopsy. The indication is eosinophilic or neutrophilic type inflammation, intranasal corticosteroid spray for 4 to 12 months, nasal gouging. For removal of mucus, infective agents and inflammatory mediators decreases nasal crusting, increases mucociliary clearance. Medical polypectomy, give clarithromycin for 6 weeks or more, surgery. Fail optimal medical therapy. These are the referral for chronic rhinosinusitis. It divides to early and urgent. There are our references. That's all from us. Thank you for your attention. Have a good day everyone.